Hi guys, it's me, Professor D. Welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, but this one is going to be for the PN and VN students. However, if you are an RN student, this still will be helpful for you. It's a Kahoot that we're going to be covering urinary disorders. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. Go ahead and give it a thumbs up. You're going to love the video. Subscribe to my channel if you haven't done so already. And if you're studying for your boards, be sure to go to my website, nexus-nursing-institute.com, and sign up for my next generation NCLEX review, both part 1 and part 2. If you're a current nursing student, you're just trying to get by, you're trying to pass your exams, I have audio lessons available that may be of benefit to you. You can check them out by going to my website, nexus-nursing-institute.com. While you're there, be sure to check out my calendar. Maybe you want some one-on-one private tutoring sessions or a consultation session. Again, my website is nexus-nursing-institute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms: TikTok, Instagram, Facebook, YouTube. My handle's the same everywhere, Nexus Nursing. Okay, guys, without any further ado, let's get started. Urinary disorders for the PN or VN student. Okay, first question. So you applied an external condom catheter to an incontinent patient. Which is the best action to avoid urinary meatus irritation? Would you lubricate the penis? Would you roll the sheath upwards? Would you leave space below the urethra? Or would you keep the penis in the downward position? You've applied an external condom catheter to your incontinent patient. What is the most important thing to do to avoid urinary meatus irritation? What do you guys think? Wow, most of you guys chose lubricate the penis. No, the correct answer is leave space below the urethra. You really want to leave about 1 to 2 inches. I want you to think about it. If you apply that condom catheter and there is no space and that patient urinates, where's that urine going to go? It's going to sit on the urinary meatus. Is going to sit right there and cause irritation, right? It's going to disrupt the patient's skin integrity in that area. So you want to leave about 1 to 2 inches, okay? Most of you guys chose lubricate the penis. Let me ask you something. If you lubricate the penis, how is that external condom catheter going to stay on if it's lubricated? Why are you lubricating the penis? You're not about to have intercourse. What are you talking about? No, that's wrong. 2 of you guys chose roll sheath upward. You do roll the sheath upward, but the question's asking about avoiding urinary meatus irritation. Rolling that sheath upward is going to keep the condom catheter on the patient, but it's not going to do anything to prevent irritation. What we're going to do to prevent irritation is make sure that there's space so that when the patient urinates, that urine isn't just sitting on the penis area. Last, keep the penis downward. 9 of you guys chose that as an answer. Guys, normally, unless something's going on, naturally that penis is going to stay in the downward position, whether sitting, standing, whatever. But again, the point of the question is about avoiding irritation and keeping the penis in the downward direction is not going to help avoid irritation, but leaving space about, again, 1 to 2 inches below that urethra is going to help prevent irritation, okay? You guys are hilarious. All right. Next question. At the nurse's station, you hear the unlicensed assistive personnel angrily and loudly stating, "I can't believe number 211 is wet again. This is so annoying." What law did they violate? Is it the Good Samaritan law? Is it the Hippocratic Oath? Is it HIPAA? Or is it Nexus nursing law? What do you guys say? Very good, HIPAA. That is that patient's private medical information, and you're over there blabbing their information, and you're providing identifying information such as the patient's room number, right? That would identify who the patient is. So you're violating HIPAA. And notice HIPAA's with 2 A's and not 2 P's. I hate when people do that. We're not talking about hippopotamuses, okay? HIPAA. So let's talk about the other ones. Good Samaritan law that actually protects you when you're providing first aid in an emergency situation. The Hippocratic Oath, that is the oath that physicians take to cause no harm to the patient. And of course, one person chose Nexus nursing law. That's funny. Appreciated, but no, there is no Nexus nursing law. I just made that up, right? So HIPAA, we don't want to violate a patient's medical privacy. All right, what's the most important nursing assessment before starting a bladder retraining program? So you're going to do a bladder retraining program with a patient. What is the most important nursing assessment or nursing intervention to do before that? Is it to note the times at which the patient's incontinent? Are you going to check the urine specific gravity? Are you going to assess for bladder distension, or are you going to weigh the patient daily? What's the most important thing to do before you start a bladder retraining program? Huh. Most of you guys chose assessing for bladder distension. You do want to assess your patient for bladder distension, but the question is, what's the most important nursing assessment before you actually start a program? If you're going to start a program to help that patient retrain their bladder, doesn't it make sense? Is it the most important thing to do to actually know, when is that patient incontinent? Are they incontinent in the mornings? Are they incontinent in the afternoons? Are they incontinent right before lunch or right after lunch? It's important. You have to identify the trend, because how are you going to create a program for your patient and you don't even know the trend of the patient? You don't know, you don't even know how you're going to create that bladder training program, because you have no idea when your patient's incontinent. So the first thing you're going to do is what? Get information. And so what you're going to do is you're going to pay attention, and you're going to look to see, okay, when is this patient incontinent? What are they doing around the time that they're incontinent? Because all of that is going to be part of your plan. Things you're going to prevent them from doing, things you're going to teach them not to do, the ways you're going to teach them to do things. So it's about getting information. All right, your incontinent patient wants to restrict fluids so that they can stay drier for a longer period of time. What would be your response? Would you encourage this idea because it shows that they're trying to be compliant? Would you discourage the idea because restricting fluids can cause constipation? Would you encourage the idea because the goal is for them to stay dry? Or would you discourage the idea because it could cause fluid imbalance? Very good. You're going to discourage the idea because it can cause fluid imbalance. Guys, there are very specific situations or medical conditions where patients going to be on restricted fluids. We don't like restricted fluids. Fluids are important. Fluids help with homeostasis. Fluids help to, flush your system, help flush toxins out of your system. We love fluid, right? We want to keep fluid balance. So we really don't restrict fluids unless we absolutely have to. And so that is the correct answer. And by the way, fluids also help decrease constipation. If the patient's constipated, what's the first thing you tell them? You tell them to increase fluids. You tell them to ambulate. You want them moving around. You tell them to increase fiber. All right, your incontinent patient says, I'm not a man anymore. I'm just a baby. What should your response be? Would you say, you're the kindest person I've ever met? Do you say, cheer up, things will get better? Do you tell them, don't worry, incontinence is an expected finding at your age? Or do you say, you're discouraged at the moment? What should your response be in a situation like this? Okay, wow. Let's talk about this. Most of you guys got the correct answer, saying you're discouraged at the moment. Let's talk about the wrong answers and we'll come back to the right one. 3 of you chose, you're the kindest person I've ever met. What does them being the kindest person you ever met, what does that have to do with them saying, I'm not a man anymore, I'm just a baby? They're incontinent. They can't, control their bladder. And so the person says, I'm not a man anymore, I'm just a baby. When you tell that person, You're the kindest person I ever met. What you're really saying is, yep, you're right. You're not a man anymore. You're just a baby, but that's okay because you're nice. That's ridiculous. Okay. You're completely ignoring what that patient just says. You're not even addressing the expression of that emotion. So that's false. That is not therapeutic communication. Matter of fact, that's a block to therapeutic communication. One person, I'm happy only one person chose this. One person chose cheer up, things will get better. Let me tell you something. We don't ever use those cliches. We never say cheer up. Oh, there's a light at the end of the tunnel. Tomorrow's a better day, things like that. No, absolutely not. We don't say things like that. And we don't give advice. We're not judgmental. Saying cheer up, things will get better. That does not help the situation. The patient says, I'm not a man anymore. I'm just a baby. And you tell them to cheer up about it. That makes no sense. 9 of you chose, don't worry, stop. Stop right there. I don't even need to read the rest of that sentence. In nursing, we never, ever, ever, ever say to a patient, don't worry. We never ask a patient why. WHY, we don't use that word. We don't say, why did you, right? And we never say, what made you? What made you do that? Those are 3 things you never say to a patient. That is not therapeutic communication, so that's wrong. And of course, the correct answer is saying you're discouraged at the moment. You're making an observation. The patient says, I'm not a man anymore. I'm just a baby. They're frustrated about incontinence, right? So you making that simple observation of saying you're discouraged at the moment. That is a form of therapeutic communication. You say that and you shut up. You allow that patient to think about that statement and they say, well, yes, I'm very discouraged. I've been trying to do this for a long time. It's not working, blah, blah, blah. But you're giving them an opportunity to express themselves. And that's what therapeutic communication is all about. You always want the patient to open up and share how they're feeling. All right, select all that applies. Your patient's been diagnosed with a urinary tract infection. Which symptoms would you expect to assess in this type of patient? So here are your options. Let me move this for you. Sharp flank pain, urethral discharge, WBCs in the urine upon urinalysis, burning on urination, urgency, frequency. Which symptoms would you expect to see in the patient with a UTI? All right, so 15 of you guys chose sharp flank pain. Sharp flank pain, you should be thinking of something like pyelonephritis, right? An upper urinary tract infection, okay? We're talking about UTI, cystitis, inflammation of the bladder, infection is present. We're not talking about pyelonephritis. When you see sharp flank pain, you should be thinking more kidneys, ureters, okay? Urethral discharge, 9 of you guys chose that. That's also incorrect. We see that more in something like, sexually transmitted infection, not a UTI. WBCs in the urinalysis, absolutely. Absolutely. We should not see that in the urine. You see that in the urine, you should be thinking, yep, UTI. Burning on urination, absolutely. That's what? Dysuria. That's pain. Urgency, them keep feeling like they have to urinate. They just emptied the bladder. Now they feel like they got to go again. Urgency, absolutely. And of course, frequency, they keep going to the restroom to urinate. So those are the correct answers for UTI. You guys do need to know those signs and symptoms of UTI, guys. True or false? Concentrated urine will have a strong smell and be light in color. Is this true or is this false? I'm so proud of you guys. I tried to trick you. I tried to trick you because the beginning was correct. Concentrated urine will have a strong smell, right? That's true. But remember what I always teach you. If the whole thing is not correct, guess what? The whole thing is wrong. And the tiny part at the end where I added and will be light in color, because this part is wrong, the whole thing is wrong. And that's how NCLEX gets you. They will give you a beautiful answer choice with one tiny little thing that's incorrect. Because that one tiny little thing is incorrect, I don't care how beautiful that answer is to you, it's wrong, and you have to go with the second best option that you see. So I'm so happy only 4 of you guys chose yes, but everybody else realized that's wrong. If the urine is concentrated, maybe that patient's not, dehydrated, they're not drinking enough fluids, it's going to have a strong smell, but it's going to be dark in color. It's not going to be light in color. Matter of fact, that's one of the ways you can kind of tell, like if a patient's dehydrated, they're not drinking enough fluids. If you look at that urine and it's concentrated, it's very dark in color. All right, why is a diabetic patient at higher risk for acquiring a bladder infection? Why are they higher risk for UTIs? Is it because glucose supports bacterial growth? Is it because diabetes suppresses WBC activity? Is it because diabetics patients, they urinate more frequently? Or is it because the urine is more concentrated in diabetic patients? Very good. Glucose supports bacterial growth. Bacteria loves wet, moist, dark, and sugary environments. That's where they grow, right? So that glucose absolutely provides a perfect environment or medium for bacteria to grow. Nobody chose diabetes suppresses WBC activity. That's great because that's not true. 4 people chose diabetic patients urinate more frequently. They don't. They're not supposed to. Now, if a patient comes in and they say, you know, I don't know what's going on, I'm urinating a lot more frequently than I used to, you'll check the urine. And one of the things, maybe that patient is diabetic and they were never diagnosed, right? But if a patient's urinating a lot more frequently, they're diabetic, you know, maybe they're going through decay, something's going on. But a diabetic patient, just because they're diabetic, that doesn't make them urinate more frequently than anyone else. That's number one. And then number two, if, and this is not true, I'm just saying if the diabetic patient were to urinate more frequently than anyone else, guess what? It would have the opposite effect, because the more that you empty your bladder, the lower is your risk for having a urinary tract infection. That's why when you're teaching patients about UTIs, you teach them increased fluids and you tell them what? To empty their bladder often, because what happens is bacteria, besides loving a wet, moist, dark, sugary environment, they also grow in stasis. So when fluid's not moving. So if you know, the person who holds their urine all day long, they're going to be at increased risk for UTI because that fluid is just sitting there. Any fluid that doesn't move, bacteria is going to start to grow, okay? And last, 3 people chose the urine's more concentrated in diabetic patients, and that's just not true. So the correct answer is glucose supports bacterial growth. All right, which substance in a urinalysis or UA is most suggestive of bladder infection? Would it be glucose? Would it be blood? Would it be bilirubin, or would it be protein? What do you guys think? I see all the hearts. Thank you for liking the live, guys. Thank you. Oh, wow. 17 of you guys went with protein. All right. Well, let's talk about the correct answer first, which is blood. Only 4 of you guys chose blood. Yeah, that's most if between these choices is blood. You see blood, pus in the urine, you're going to be thinking bladder infection. Now let's go through the wrong answer choices. Glucose. You're not supposed to have glucose in the urine. But if you do see glucose in the urine, that would be suggestive of possibly what? Diabetes, right? Um, How about bilirubin? Two people chose bilirubin. You see bilirubin in the urine, you should be thinking possibly, there's liver dysfunction, or maybe something's going on with the gallbladder. That's when you see bilirubin in the urine. And protein. 17 of you guys chose protein. You see protein in the urine. You're not supposed to see it, but if you do, you shouldn't be thinking of bladder. I mean, that protein was sitting there in the urine, which is in the bladder, but that's not the problem. You should be thinking of kidney dysfunction, because the kidney is responsible for filtering out the blood. And protein is very, very, very large. It's not supposed to be released out to the urine. It should have went back to the bloodstream. So if you're seeing protein in the urine, you should be thinking of kidney dysfunction, not bladder dysfunction, right? So the correct answer is blood. All right, type in your answer. What is a drug class of, I'm going to try to pronounce this medication. No, I'm not. You guys see the medication. What drug class is it? Phenazopyridine. I think I said it. Phenazopyridine. What is a drug class? And you guys, and this is for both PN and RN, you guys have to know this medication. You have to know the drug class. You have to know the nursing interventions and teaching for this medication. What's a drug class? Kidney pain reliever, analgesic, urinary analgesic. Very good, urinary analgesic. Wait, nobody chose the correct answers? Let me see what answers you guys chose. Review answers. Only one person answered kidney. Okay, all right. Anyway, this drug, guys, it is an analgesic. This is very important because if you're in a nursing program or you're taking NCLEX, you see this medication, usually one of the choices they give you is an antibiotic. It is not an antibiotic. It is an analgesic, okay? What it does, it helps to decrease the pain, okay, in the lining of the urinary tract. So it helps to decrease that burning, that dysuria that the patient experiences. All right, type in your answer. Which urine characteristic would you warn the patient about if they've been prescribed that same medication I just mentioned? Okay, that same medication, which we all agree is a urinary analgesic. If your patient has been prescribed that medication, what are you going to warn them about in regards to their urine? Zay, I need you to be more specific. Be more specific. What are you going to warn them about? Color, dark orange, color, appearance, a bladder infection. Very good. Orange color. You have to warn them that, oh, sorry, guys. You have to warn them that that medication will cause the appearance of their urine to turn orange. It can even stain their underwear. If you don't warn them in advance, they're going to freak out. Okay. So you're going to warn that patient about that in advance. A couple other things you guys got to know about this medication. Remember, again, it's an analgesic. It's not an antibiotic. It'll turn their urine orange. If the patient wears contact lenses for the time that they're taking this medication, you're going to tell them to wear glasses, because what happens is it can turn their bodily secretions, besides urine, it can turn even their tears orange. And so you don't want it to stain their contacts, because if it stains the contacts, it's permanent, right? So you're going to teach them to wear glasses for the duration of the time that they're taking this medication. All right, what change in urine elimination shows that this medication is achieving its therapeutic effect? So how do we know this medication is working? Is it because of improved frequency? Is it because of improved urgency? Is it because of improved dysuria? Or is it because of improved output? How would you know that this medication is working? All right, very good. Most of you chose the correct answer. Improve dysuria, because remember, it's a analgesic, so it's going to help decrease that pain that the patient has when they urinate. Okay, guys, last question. Select all that applies. Which actions are most effective in reducing bacterial growth in the female patient's bladder? Select all that apply. Here are choices: increase fluid intake, change underwear daily, avoid public restrooms, urinate after sexual intercourse, drink highly alkalinic fluids, wipe from back to front. Select all that apply. Which actions are most effective in reducing bacterial growth in the female patient's bladder? Okay, let's talk about this, guys. We'll go in order. So the first one, increase fluid intake, absolutely. Increasing fluid intake, it flushes your system, it flushes your bladder, you get those pathogens out, absolutely true. 20 of you guys chose changing underwear daily. Now, this is a wonderful hygienic practice, it's something you should do, but it doesn't reduce bacterial growth in the bladder. We're talking about bacterial growth in the bladder. So even though changing underwear daily is a great hygienic practice, it doesn't reduce the growth of bacteria in the bladder. So that's false. Avoiding public restrooms, that does not reduce bacterial growth in the bladder. Urinating after sexual intercourse, it does. Because during sexual intercourse, pathogens or bacteria that may have been on the penis or whatever can be introduced into the woman's urethra, right? So when you urinate, you flush it all out so it doesn't have a chance to creep up into the bladder and reproduce. So that is true. Drinking highly alkalinic fluids, false. If anything, studies have shown that drinking highly acidic fluids, like, cranberry juice, things that are acidic, what it does, the bacteria doesn't like the acidity. They don't like acidic environments. So instead of sticking to the inner lining of the what's it called, of the bladder, right? If that environment is acidic, it won't stick to the inner lining of the bladder. So when you urinate, it's more easily flushed out of the patient's system. Okay, so drinking highly acidic fluids is favorable just because it creates an acidic environment in the bladder. And again, bacteria does not like acidic environments. So instead of sticking to the bladder, it'll just hang out in the urine. So as soon as the patient urinates, poof, it comes out. So that's false. And of course, 2 people chose wiping back to front. I want you to think about what you're doing when you're wiping back to front. You're taking that fecal matter, those pathogens, those bacteria, all that crap that's back there in that area, and you're bringing it up to the front so they can climb up the urethra and go to the bladder and cause a UTI. That makes no sense. You're always going to wipe the other way. You're going to wipe from front to back. So the only correct answer choices here are increasing fluid intake and urinating after sexual intercourse. And guys, that's the end of this Kahoot. Let's see how you guys did.